DREDF, Healthcare Stories. Carol Gill and Larry Voss are being interviewed in the living room of their home in Darien, Illinois. Their interviews are presented in 6 parts. This interview is part 1.
My name's Larry Voss. I live in Darien, Illinois, a suburb of Chicago, and I'm a researcher at the University of Illinois at Chicago in the Department of Disability and Human Development.
I'm Carol Gill, and I also live in the suburbs of Chicago, and I work at the University of Illinois at Chicago, and I'm on faculty in a disability studies program, and I also do research on the disability experience.
I had polio at the age of 4 and became a wheelchair user since then. Currently I use a power chair, and because of post-polio syndrome, I have a lot more weakness in my muscles and use a ventilator at night to help me breathe at night.
I had polio at age 5. I think it was about a year before the Salk vaccine was distributed. And initially, I was in an iron lung, and I was in the hospital for like 9 months after I had polio, so it wasn't the days of managed care. My disability affects my life, I think, in making it often more complex and less spontaneous because I have to do a lot of planning. But on the other hand, it challenges my creativity. And like a lot of people who've been disabled from an early age, it's not uppermost on my mind all the time, and it's become a normal part of my life, in a sense. Certainly an ordinary part of my life. So in many ways, I consider my disability more of a lifestyle issue than a medical diagnosis. And so I think that when I go to a hospital and other people regard me as a medical case, it always kind of startles me because I see my life as a lifestyle, and maybe one that's, in a sense, almost culturally different from the average lifestyle, but still, extremely valuable.
About 5 years ago, I had a lot of discomfort in my abdomen and lower abdomen, and it got to the point where I felt I needed to go to the emergency room to see what was going on. It was diagnosed originally as a bowel obstruction, and they did an x-ray at the time, and the person who was on duty at the emergency room was a surgeon, and when she looked at the x-ray, she said there was a small spot there that looked suspicious to her, and at the time she recommended that we investigate, and she thought it would be a good idea to do some type of surgery to go in there and look. And my immediate response was, well, this is not my usual hospital. People here don't know me. My doctors aren't here, so I'll follow up with my regular doctors. And I told her, thanks, the original cause of my discomfort seemed to clear, and I went to my internist, which was at a major hospital, and told him, the information, and he followed up getting the information from the local community hospital here, and it was recommended by him that I have an MRI. And at that point, it all seemed to be very normal, and things would proceed as usual, but he gave his nurse the responsibility of scheduling the MRI, and I pointed out when she checked with me that when I lay down because of breathing difficulties, I use a ventilator, which at that time it was just a mouthpiece that I held in my mouth and used to assist my breathing, and that I would need to do that for the test. And she said okay, and she would schedule the test, and things were left there. And after about 4 or 5 weeks, when we hadn't heard anything, we called back and said, what's going on with the test? And she said, because of the ventilator, they were having difficulty finding a way to schedule the MRI, and they were going to continue to try and resolve the problem. And we waited several more weeks and called back again, and she said, well, I'm still working on it, I'll get right back to you. And after, I guess, even a few more weeks, she said, well, I did find a place where we can schedule your MRI, and she gave me the address, and it was an outpatient facility connected with the hospital. But when I went there, we found out that there was no way that physically they could get me as a wheelchair user and a vent user onto the exam table that they used for the MRI, and they didn't have a Hoyer lift or any kind of other ways of giving me access to that equipment. So after going down there, we were essentially said, sorry, we can't help you, go back home. And we did, and continued to try and follow up with the doctor, my internist, about scheduling the MRI. So finally we did get a call from the nurse that she had found an accessible facility. This took about 9 months in total, and when the scan was done, the MRI was done, they found that what had originally been a much smaller growth that they detected had become almost double the size during the course of the time it took to scan, to set up the imaging. Well, I think, what we found out after many other scans that were done in my treatment and many other MRIs and CT scans was that really this shouldn't have been a problem at all, that they had done other people using ventilators, and that there actually was a protocol for doing it, but the doctor that I had and his nurse evidently were completely unaware of that.
They also didn't get back to us in a timely way. We had to pursue it over and over. We didn't hear anything, and then we'd have to call.
Yeah,
And
every 6 or 8 weeks,
right.
we would call and say, really, don't we need to pursue this? What might have been a much simpler operation to remove a smaller tumor became quite an expensive surgery to remove a very large tumor. My internist then recommended a surgeon at the same facility who we met with, recommended a procedure which was called a hemipelvectomy.
It's easy to talk about this stuff, isn't it?
No, I don't like talking about this stuff. Okay.
It's hard.
So the first surgeon I saw recommended a procedure called a hemipelvectomy, which involves removing part of my pelvis and my entire leg because of location of the tumor. And when I expressed a lot of concern about this, he expressed his opinion that he didn't see why that would make a big deal to me, since I wasn't walking anyway and was a wheelchair user. And it just amazed me that he couldn't see all the other aspects of losing a major part of your body might have, even though you couldn't walk. And both psychologically and actually physically, in terms of balance and being able to move around and do activities during the course of the day.
I don't think a non-disabled person would have been told by their surgeon, well, I'm thinking that what we could do is amputate a quarter of your body, which is what a hemipelvectomy is, and would have told a non-disabled person, but don't worry about it because you have a sedentary lifestyle, or you're not a tennis player, so it shouldn't be a big problem for you. But that's exactly what he said to Larry was, well, but the good thing is for you, it won't be as much of a loss because you don't walk anyway. That's a big assumption.
So later I saw a second surgeon who, said he could do this without that type of a radical procedure, and I did have that surgery, and it appeared to go very well. The tumor was removed, and he felt very positive about the outcome.
Larry ended up having his, successful surgery and got to keep his leg. And there was also a concern because the tumor was in the pelvic space and it had become pretty large. They were concerned that he might lose part of his bowel and his bladder, and none of those things happened. It was a very skilled group of surgeons that operated on him for 12 hours and had 5 specialists, so we can't complain at all about the quality of the surgical intervention. And so we did get that, but we had to fight for it, because when we were with the original hospital and their oncology and surgical team, they were saying, well, essentially, this tumor is pretty inoperable, and so they recommended that hemipelvectomy. But we thought maybe another team of surgeons might have a different view, so we went to another hospital, a prominent one as well. They were both very prominent hospitals. And we saw a surgeon who was fairly young, and he took a very different view and thought the surgery he should do would be one that preserved Larry's functioning in his life and his body as much as possible. So we were pretty happy to have found them.
I was about to go home and be released from the hospital about 2 weeks after surgery when I had a major infection set in. The infection, it grew and it essentially went to a point where I became so ill that I was unconscious.
Healthcare Stories. Made possible with generous support from the Manuel D. and Rhoda Mayerson Foundation. Carol Gill and Larry Voss were interviewed at their home in Darien, Illinois, July 2011. For more information, visit the Disability Rights Education and Defense Fund website, dredf.org/healthcare-stories. This work is licensed under a Creative Commons Attribution Non-Commercial Share-alike 3.0 Unported license.